Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. The foundation recently hosted a workshop on the role of focus ultrasound in pancreatic cancer. We talked with three experts in the field, Dr. Joan Vidal-Jové of Comprehensive Tumor Center Barcelona, Dr. Feng Wu from the University of Oxford, and Dr. Jae Young Lee of Seoul National University Hospital. They spoke with us about the latest in their research and how they are utilizing focus ultrasound.
My name is Jae Young Lee. I'm a professor in the Department of Radiology at Seoul National University Hospital.
And you recently completed a phase 2 clinical trial using focus ultrasound in treatment for pancreatic cancer. So can you tell us more about that study?
Yes, as you said, I recently completed a phase 2 clinical trial involving 60 patients with pancreatic cancer, utilizing the ultrasound-guided Ep18 focus ultrasound device. In this study, we combined the FOLFIRINOX chemotherapy regimen with mechanical stimulation using FUS. Each patient received 4 FUS treatments administered every 2 weeks, followed by a period of monitoring. The results were quite encouraging, with an objective response rate of 63%, which is significantly high. Additionally, we observed promising rates of surgical resection and survival among the participants. What excites me the most is seeing the consistent results from our preclinical experiments now being replicated in actual patients. It is truly rewarding to witness these outcomes translating from the lab to clinical practice.
And what's next? Will you be doing a phase 3 clinical trial?
Yes, we are about to embark on a phase 3 clinical trial with the support of the Focus Ultrasound Foundation, where we plan to conduct a randomized clinical trial involving 240 patients. The primary endpoint for this trial will be survival. And if our treatment demonstrates effectiveness even in survival, it has the potential not only to impact pancreatic cancer treatment, but also to shift paradigm of tumor treatment using focus ultrasound more broadly. This possibility is incredibly exciting to me, as it could open new avenues for non-invasive cancer therapies across various tumor types.
Yeah, it sounds like a lot of important work going on, and we'll definitely be looking closely, keeping an eye on how that clinical trial goes. And you're looking at tumor suppression in the pancreas using focus ultrasound as well. Can you tell us about that?
So we are using mechanical stimulation, focus ultrasound condition, not thermal ablation or histotripsy. It is related to sonoporation, inertial cavitation, and increased permeability in cell membrane. So no harm to patients, no pain, no discomfort. So it is very useful to apply patients because it doesn't have any harm and hazard. Based on our animal research and our 2 clinical trials, it is definitely enhances drug delivery. So yeah, I am very happy to talk about that.
Fantastic. And what excites you about the future of focus ultrasound treatment?
First of all, I want to prove the clinical efficacy in survival when we apply our focus ultrasound condition. After that, we have to prove what is the best option to enhance survival in patients with pancreatic cancer. It can combine histotripsy at the center of the tumor, and then we use mechanical stimulation as we use, but we do a lot of research about that.
Well, thank you so much. We really appreciate talking to you, and we wish you and your team the best.
Thank you so much.
My name is Feng Wu. I'm working at the University of Oxford, the non-field Department of Surgical Sciences, as a senior clinical scientist. I'm also serving as a consultant in HIFU therapy in Oxford University hospitals.
And you and your team have treated over 50,000 patients with focus ultrasound, and you helped establish the first clinical HIFU unit in the United Kingdom. Have you focused only on HIFU for tumors, or are there other areas that you've used it with?
In the beginning, we focused on the tumor ablation, but in the past 10 years, we also carry out drug delivery with focus ultrasound. So we have very successful clinical trial for drug delivery or chemo drug to the liver metastasis. And the result shows very good because the local concentration of drug. So the chemotherapy, the big issue is about the concentration of drug in the tumor site. Generally speaking, about 99% drugs through our body, less than 1% drugs in the tumor. So how to increase the concentration of drugs? There's no option. But use ultrasound, we can force the drug into the tumor. So increase the drug concentration from 2 to 10 times the normal level. And also very easy to see the response of tumor.
And it proved successful and safe?
Yes.
That's incredible. What was it like seeing those results?
We published, actually. And so we first finished the trial for the liver cancer and moved to the pancreatic cancer, because pancreatic cancer is the most difficult one due to the structure. So we may combine drug delivery with the ablation. HIFU ablation is for palliation. It's not a cure. It's for pain relief, for the quality of life improvement. Some study shows there's a benefit in survival time. But on the other hand, the drug delivery also has its own limitations. For instance, the blood supply in the cancer is different compared to the marginal area and the central area. And the marginal area, the blood supply is very rich, but in central is very less. So if you drug delivery, you have a big problem how to get the drug into the center of the tumor. This is one limitation. A second limitation is about, you may know, dormant cancer cells. That means the cancer cells in sleeping, they don't be sensitive to the chemo. So this is why we have to use chemo many, many times. So how to overcome the limitation from thermal ablation and drug delivery? So we should combine both therapies together to provide the tremendous benefit to our patients.
Absolutely. And are there any other areas that you're using HIFU right now, or anything that excites you about what's to come for the focus ultrasound field?
In my past 30 years, I focus on the tumor therapy. But as ultrasound can be used in very high energy, very low energy, you can use a different frequency. So you can use high energy for thermal ablation. You can use very low energy for other purposes. So it's not only tumors, cancers, it's only about our bodies. This is a massive implantation in the future because we can adjust the energy delivered and we can adjust the frequency. We can design different kind of transducer for the treatment purpose. So we should have more clinical evidence or clinical trials, particular randomized clinical trial, to convince the medical society this technology is a pure non-invasive therapy, will reduce the cost of the intervention and short stay, and with a great benefit to our patients. So this is most important issues.
Well, thank you so much, Dr. Wu. It's been fantastic talking with you.
Thank you.
My name is Joan Vidal-Jové. I'm a surgical oncologist. I work in Barcelona, the Comprehensive Tumor Center, and my role there is director of this institution.
You're the principal investigator for a recent clinical trial using histotripsy to treat liver cancer. But before that, you also used focused ultrasound in the treatment of pancreatic tumors. Can you tell us about that?
Yes. So I was more than 10 years ago, found this technology, focused ultrasound, for me was a great surprise and a very challenging situation because I was coming from the surgery and I was moving from doing big operations, surgery for liver metastasis, for peritoneal carcinomatosis, to a non-invasive platform. So that for me was very exciting and very rewarding because I was able to treat patients with complicated diseases with much less harm that I was going to obtain with the previous thing. So at that time, so it's a long period of 10 years of doing focused ultrasound with different techniques. Basically, the one was ultrasound-guided HIFU. That was with the Chongqing device from China. And then I moved to histotripsy when I was leading the first in-human trial for liver, because I was helping the Histosonics, which is a company that approached me to help them develop this technology in the first trials. And well, the difference between these two techniques is that both are good techniques in order to treat pancreatic tumors, because are actually the only ablative techniques that can reach to very profound organs and very profound tumors. And well, with HIFU, the difference is that is a thermal energy and histotripsy is cavitative. And this cavitative energy for me added a good, better thing that was the activation of the immune system, and we can talk about that later. But the activation of the immune system for me is what makes a difference of this technique.
Were there any challenges going from treating tumors in the pancreas to treating tumors in the liver?
Well, when I was doing HIFU, focused ultrasound with thermal energy, it was, the problem, the main problem was how to approach to the tumor without harming all the organs that are around the pancreas. So the pancreas, it's an organ that it's situated very deep into the abdomen. It's surrounded by structures. It's an organ that we cannot obtain margin of the tumors because some of these tumors are to the rim of the organ, close to the vessels, close to gastrointestinal structures, close to nerves, close to a lot of things that you can harm. So the difficulties here is to be very precise and not to harm other things. So that was the difference between the liver and the pancreas. Because in the liver, you can reach a tumor, you can treat it, and you can obtain a good margin. But in the pancreas, this is not possible in most of the cases. So unless you have a very small tumor, that you can obtain a margin, but normally those tumors can be resected. And if they can be resected, it's better that they go for surgery.
Will you be changing any approaches to your work in the future?
Well, my goal is, and I always have it in my mind, is to improve patients' lives. So I want to make an impact in people's life. And pancreatic cancer is people that are suffering a lot. And they have probably in cancer trials are the people with less hope expectancies. And to change this thing is for me is what is most important. So if we can improve their quantity of lives with a good quality, so great timing, great survival with good no harming approaches, that's the objective.
Was there anything that surprised you in the clinical trials for either using histotripsy or treating pancreatic tumors?
Well, for histotripsy, that what really surprised me, and I mean, we were considering that what may happen, but the amount of success or the amount of response of the immune system that we have found in the liver, it's outstanding. So because I remember when I was doing HIFU with thermal energy, we were able to see immune effects 1 out of 30 cases, so which is a low percentage. But now in our trial, we saw it in 1 out of 4, which is a 25%. But now the physicians that are treating patients with lithotripsy in a normal clinical setting, they're finding this 1 out of 3, which is more than 30% of the cases. So that means that there is something with these techniques that impact on the immune system. And we need to characterize that. And one of my next challenges and my next objectives is to design a trial that we are going to try to provoke, to characterize, and to understand better how to manage and increase the surge of this immune effect.
That's going to be so interesting, and we'll definitely keep a close eye on that. I was going to ask, what's next for you and your team? Is there anything that you'll have to do different with that clinical trial, or anything that is a new way to look at using focus ultrasound technology in treatment?
I think we have to stop thinking on the old ways that we have to fight against something. We don't have to fight against anything. We have to collaborate with the immune system. And one of the ideas that I try to give to my team when we talk is that we're not going to get rid of the pancreatic tumor. We're going to disrupt the tumor microenvironment. We're going to allow the immune system to expose the tumor antigens there, because the immune system of the patient that is in good shape can fight against that. So we're trying to move the battle from outside to inside of the patient and make the immune system of the patient to collaborate with us.
That's such an interesting perspective and way to think about it. I hadn't heard that before. Is there anything that excites you about the future of focus ultrasound, or just the possibilities there are?
Well, I think that more and more medical oncologists, surgeons, interventional radiologists, all the people, clinicians, understand that this technology is here to stay, that it's helping a lot of patients now, and in the future will make a difference. It will not be only surgery, radiotherapy, chemotherapy, but it will be also the immunotherapies and the focus ultrasound technologies. And this is something that is going to impact in how the tumor boards sees the patients. So to having a metastatic disease is not longer going to be like a death sentence. It's going to be a different approach that can treat these patients and provoke longer and better survivals.
Well, thank you so much. We really appreciate it, and appreciate all of the important work you and your team are doing.
And thank you to the Focus Ultrasound Foundation, because the Focus Ultrasound Foundation is doing a great job putting us together, pushing us to do better research, mixing different specialties that normally they go to their other and to the oral specialty congresses, and putting out all these people together. This is a role that the Focus Ultrasound Foundation is doing in an excellent way.
We hope you enjoyed this conversation from the Focus Ultrasound Foundation's Pancreatic Cancer Workshop. This is one of many workshops the foundation hosts. If you'd like to know more about other upcoming workshops and events, please visit fusfoundation.org/events. This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you would like to learn more about Focus Ultrasound or the foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media.